Lipoedema is a condition that causes painful fat buildup in the legs, hips and arms and affects millions of women worldwide. Lipoedema UK is helping to educate the public and healthcare professionals about the disease, as well as advocating for improved diagnosis and access to better treatments. We met Köhler, a consultant plastic surgeon, and Sandra Slaughter, a patient with lipoedema.
Dr. Köhler, Sandra, welcome. Thanks so much for joining us today. Dr. Köhler, if I can start with you, tell us a bit about lipoedema, what it is and who it affects.
Lipoedema is a condition that affects the subcutaneous tissue, the fat. So it usually only affects your legs, your thighs, your knees, your ankle, your buttocks and your hips, as well as your upper arms. It mainly affects women. It has a genetic and a hormonal situation underlying, which we're trying to find out more about it.
And Sandra, you've been living with lipoedema for 50 years. Yes. You have two daughters who also have the condition. Yes. How has that been for you and for them?
Hard, very hard. For myself, having it undiagnosed for the majority of my life, it first presenting around the age of 8 or 9, visibly noticeable that my legs were different to other girls in our PE classes at school. It has led to a life that has influenced my choice of clothes, my relationships, sport, and really affected my self-esteem and confidence.
And your girls as well, it's been similar for them, hasn't it?
It was, the diagnosis came very late for me, and this is one of the aspects that we've shared, because for me, I had a lot of limiting beliefs and a lot of self-judgment and discomfort. For my daughters having the diagnosis, suddenly they were free from blame. Every medical professional that we've ever connected with in my life, I was always asking, why are my legs like this? I was consistently told I was an overeater. They then didn't have that blame.
I know you've had 4 operations, which must have been very traumatic for you, and clearly it is for the patients that you see, Dr. Köhler. What sort of specialist procedure is available for this condition?
Well, the best thing at the moment is liposuction. It doesn't cure the condition, but it does help a lot with the symptoms. And also, the earlier you get into it, the better it is later on in your life, because you don't have all these secondary effects from low self-esteem, from pain, that you lose some mobility, etc.
I was about to say, how important is early diagnosis and what sort of a difference can that make?
Yes, so as we see in your story too, that children, when they are diagnosed early, they don't live in that horrible shame that they are just eating too much and that this is all a problem of their diet, even though they can't impact it, and that they then psychologically go into a really bad place. If we treat it early, they are free from that and can develop a normal self-esteem and a normal future for them.
Yes. So Sandra, tell us about your treatment journey and how that's impacted you and your family.
We were diagnosed, myself and my daughters, together, and it was advised for me at the age I was at that surgery was essential, if I could afford it, to increase my mobility, reduce my pain. I'd already was presenting with knee problems, hip problems, my gait out of balance. So that has freed me from that. And I do have increased mobility, and I'm able to participate in sport and have a freedom of choice.
So how important now, Dr. Köhler, is research, bearing in mind what we've heard from Sandra in terms of how it's impacted her lives and that of her girls?
The research is important, that we do more and more, and the awareness that people actually will be able to diagnose lipoedema and then treat it accordingly. But if we put more focus into it, realizing how many women are affected by lipoedema, that would be awesome.
Okay. Sandra, Dr. Köhler, thanks so much for joining us. Thank you.
Thank you.